Hi, I'm Dr. Schildhorn, and I'm a fellowship-trained surgeon in orthopedics. I do have a specialty interest in shoulder procedures and shoulder surgery. Now, the shoulder is the most unstable joint in the human body as it is. It can go in every direction, and that's its beauty, but it doesn't have a lot of room for errors. I see a lot of different shoulder problems, from acromioclavicular joint pain to impingement, shoulder dislocations and instability. I see rotator cuff tears. These are the common things people see in the shoulder. Slap tears or superior labral tears is another way of saying that. In fact, I injured my shoulder when I was 16 years old playing baseball. And 3 months later, it happened again while I was surfing. And that time was really bad because I was in the ocean, there was a hurricane, and I had to go to the hospital. And I really didn't want to have surgery at that time. And so I put it off. And 2 years later, I dislocated a third time. Of course, between the booking of my surgery and my actual surgery, I hurt it again. I had the surgery done in 1995, and I've never had a problem since. There's two types of dislocation: the ones that occur traumatically and the ones that occur in people who have relatively loose joints. And people who have loose joints, it can be for a variety of reasons. Sometimes people fall within normal limits. They don't have anything wrong with their connective tissue or their collagen or elastin, and yet still their joints are very, very flexible. And for those people, it's very important to strengthen the surrounding muscles to dynamically stabilize the joints. We practice medicine, right? We practice medicine means over time we develop our own techniques and our own styles for how we fix things. And some of the things I was taught, I do exactly the same as the way I was taught, and some things I've adapted over time. When I'm putting a shoulder back together, if I'm doing a stabilization procedure for dislocation, I have a very specific way of looking at it and a criteria for when I consider my work to be done. And for me, the shoulder has to be perfectly balanced. The ball in the socket has to be sitting perfectly centered, and that's when I know that I've done a good job. Arthroscopic surgery of the shoulder is done through small incisions, tiny incisions like a fingernail in width. You put a camera in the joint, and then through a different cannula or a different portal, you use instruments to suture things back together. You do it arthroscopically, means you're watching it on TV screen, and you're using instruments that are designed specifically for these types of procedures in order to perform them without actually having to put your hands inside of a joint. There are measurements that we take on MRI and CT scan that are able to predict the type of procedure that people will need in order to prevent redislocation. One surgery done right and a great physical therapist and physical therapy afterwards, and I was able to go back to everything I wanted to do. I've never had a recurrent dislocation or anything close to it, and fortunately in my practice I've been quite lucky with my patients as well. There are some patients that are more prone to redislocation than others, but most people, if the procedure is done right, do not come out again.